Welcome to our deep dive, you guys, into something super fascinating, neonatal care.
Ooh, exciting.
It is, and specifically, we're going to be looking at those, like, critical first moments after a baby is born.
Oh, wow.
Like, right when they come out, what are the
Yeah.
things medical professionals are looking for? What are the checks that they're doing?
Yeah.
It's really cool.
It's a delicate dance.
It is a delicate dance, and it's so important because it really sets the stage for everything else.
Absolutely. Those first few hours are really crucial for a newborn's health and well-being.
So let's, like, set the scene, right?
Mm-hmm.
We're in the delivery room. Baby's just arrived. What are the absolute must-dos right off the bat?
So the first hour is oftentimes the golden hour.
Okay.
And for good reason. It's all about making sure the baby is breathing well, has good muscle tone, and is kept warm. And so ideally, we want to place the baby skin to skin with the mother right away.
Oh, that's so sweet.
Yeah, it's incredibly beneficial for bonding, too.
And just, like, natural, you know?
Absolutely natural. It helps stabilize their temperature, and yeah, it's just the best thing.
I love that. Okay, so that's, like, the ideal scenario. But let's say things aren't going quite as smoothly.
Right.
What happens if a baby needs a little extra help right away?
So if the baby isn't breathing well, or has poor muscle tone, or needs any additional medical attention, then we immediately move to a preheated radiant warmer.
Okay.
And this is where neonatal resuscitation begins.
Whoa. Okay, so tell me more about this resuscitation process. Like, what are the key steps involved?
Well, first things first, we need to make sure the airway is clear.
Okay, makes sense.
So we position the baby on their back under the warmer in what's called the sniffing position.
Sniffing position.
Yeah, it sounds funny, but basically it helps open up the airway. Then we use a bulb syringe to gently suction any fluids or meconium from the mouth, and then the nose.
Oh, interesting. So mouth first, then nose. Why that order?
Yeah, so suctioning the mouth first prevents the baby from aspirating any fluids that might be lingering in there.
Oh, that makes sense.
It's all about minimizing the risk of anything going down the wrong way.
Yeah, for sure. Okay, so the airway is clear. What's next?
Next, we focus on stimulation. The best way to do this is by drying the baby with a warm, clean towel. This provides gentle tactile stimulation and helps them adjust to the world outside the room.
It's like their first little wake-up call.
Exactly. It's a gentle nudge into the world.
I love that. Okay, so we've got the airway clear, babies simulated. Now, how do you actually assess their overall condition? I know there's something called the APGAR score, but is it just like a number?
It's more than just a number. It's a quick and standardized way to evaluate a newborn's physical condition at 1 minute and 5 minutes after birth.
Okay.
It's kind of like a snapshot of their overall well-being in those crucial first
I
moments.
like that. Okay. So what exactly does this APGAR score tell us? Like, what are the factors that you're looking at?
We assess 5 key areas:
Hmm.
heart rate, respiratory effort, muscle tone, reflex irritability, and skin color.
Okay.
Each factor is scored from 0 to 2, with a total score ranging from 0 to 10.
Got it. So I'm guessing a perfect 10 means the baby is like in tip-top shape.
You got it. A score of 7 or above is generally considered normal, but even scores below that don't always mean there's a serious problem.
Right.
It's more about understanding the individual factors and how they relate to the baby's overall condition.
Okay, so it's like looking at the bigger picture and not just getting too hung up on the number itself.
Exactly. Now, you might be wondering how we even determine a baby's gestational age in the first place.
Actually, yes. I was just thinking about that. How do you know if a baby is premature or full term?
That's a great question. We use a combination of factors: the mother's last menstrual period, prenatal ultrasound evaluations, and a specialized exam called the Ballard Assessment.
The Ballard Assessment.
Yeah, and ideally this is done within the first 12 hours after birth.
Okay, what does that assessment involve?
It's basically a detailed examination of the baby's physical and neuromuscular maturity. We look at things like their posture, reflexes, skin texture, and ear cartilage to get a more precise estimate of their gestational age.
It's like a detective's toolkit for figuring out the baby's developmental stage.
Exactly. That's
Yeah.
fascinating.
It really is.
Yeah.
Okay, so once you've determined gestational age, what happens next?
We measure the baby's weight length and head circumference.
Okay.
And those measurements are then plotted on growth charts.
Right.
This helps us determine if the baby is appropriate for their gestational age, or if they fall into the categories of small for gestational age, SGA, or large for gestational age, LGA.
So it's all about percentiles, right?
That-
What percentiles define SGA and LGA?
You got it. A baby is considered SGA if their birth weight is below the 10th percentile for their gestational age,
Okay,
meaning they're smaller than 90% of babies born at the same gestational age.
makes sense.
And then conversely, a baby is considered LGA if their birth weight is above the 90th percentile.
Okay, so it's like the opposite end of the spectrum.
Exactly.
Got it. It's amazing how much information is gathered in those first few hours. Now, it's not just about the baby, right? The mother's health plays a crucial role, too.
Absolutely. The mother's medical history is essential.
Okay.
We want to understand any potential risks and provide the best possible care for both mother and baby.
Can you give us some specific examples of what you look for in the mother's history?
So we'll look for things like risk factors that might have impacted the pregnancy or delivery, any pertinent lab results that can help with diagnosis and treatment, and also the overall delivery history.
Right.
For example, we want to know if there was a prolonged rupture of membranes.
Okay.
What was the delivery setting like? Did the baby require any resuscitation immediately after birth? These details can provide valuable clues about the baby's health.
So it's like piecing together a puzzle with each detail adding to the bigger picture.
Exactly.
Speaking of delivery, what about C-sections? When are they necessary?
C-sections are sometimes medically necessary and can be life-saving.
Okay.
Common indications include a previous C-section, failure to progress during labor, malpresentation, meaning the baby isn't head-down placenta previa, where the placenta is blocking the cervix, and also non-reassuring fetal status, which are signs of fetal distress.
Can you break down some of those terms a bit further? What exactly is non-reassuring fetal status?
Sure, so it refers to signs of fetal distress during labor, like an abnormal heart rate pattern.
Oh, okay.
It's basically a signal that the baby might be struggling and that a C-section might be the safest option.
So these are all situations where a C-section might be the best course of action.
Right.
Okay, so once the baby is born, whether vaginally or via C-section, the physical examination begins. Where do you even start?
We begin with a quick assessment of the baby's vital signs. So temperature, heart rate, respiratory rate, and blood pressure. It's important to note that the absolute numbers aren't as crucial as the overall trends and how they relate to the baby's specific situation.
Okay, so it's all about context,
Right.
not just looking at numbers in isolation.
Exactly. Then we move on to a general inspection of the baby.
Okay.
We observe their body position, any unusual movements, skin color, perfusion.
Perfusion.
Yeah, perfusion basically tells us how well blood is circulating to their extremities.
Oh, okay, interesting. It sounds very thorough.
Yeah.
What about breathing? How do you evaluate that in a newborn?
Assessing respiratory function is critical.
Yeah.
We monitor their breathing rate, which is typically faster than in adults, and we look for any irregularities or signs of distress.
What kind of irregularities would raise concern? Like, what should parents be aware of?
For instance, if a baby's breathing is consistently very rapid, it could indicate a condition where there's extra fluid in the lungs.
Oh,
We also pay close attention to their breathing pattern. Premature babies often exhibit what we call periodic breathing.
okay.
It's an irregular pattern with short pauses, which is normal for them, but would be unusual in a full-term baby.
Got it. So it's about knowing what's typical for different gestational ages.
Exactly.
Okay, now what about apnea? How is that different from periodic breathing?
Apnea is more serious. It's a pause in breathing that lasts longer than 20 seconds
Oh, wow.
and can be accompanied by other concerning signs like a bluish skin color, a slow heart rate, pale skin, and low muscle tone.
Okay, those are definitely red flags. Now, are there any specific tools or scales used to assess a baby's breathing difficulties?
Yeah, we sometimes use the Silverman scoring system.
Okay.
It helps us quantify an infant's respiratory distress by considering factors like nasal flaring, grunting, rapid breathing, and retractions.
Wait, grunting. Babies actually grunt when they're struggling to breathe.
They do. It's an audible noise they make by partially closing their vocal cords during exhalation.
Wow, I never knew that.
Yeah, it's their way of trying to keep their tiny airways open.
That's amazing. What about retractions? What do those look like?
Retractions are visible indentations of the chest wall, usually between the ribs.
Okay.
It's a sign that the baby is using extra muscles to try and breathe more effectively.
So those are all signs the baby needs help breathing.
Right.
What about the actual breath sounds themselves? How do you assess those?
We listen to the baby's chest with a stethoscope, just like we do with adult. But it can be a bit trickier with newborns because their chests are so small and sounds can easily transmit from one lung to another.
Oh, that makes sense.
Yeah.
So you really have to be attuned to those subtle differences in sounds. Okay, after checking the lungs, what's next on the exam checklist?
We move on to the chest and cardiovascular system.
Okay.
We look for any abnormalities in the chest wall and listen carefully for heart murmurs, which are extra sounds heard during the heartbeat.
Okay.
Many murmurs in newborns are harmless and disappear on their own.
Oh, that's good to know.
Mm,
So it's not always a cause for concern.
exactly.
What else is involved in the cardiovascular assessment?
We check the baby's pulses in different parts of the body, making sure they're strong and rhythmic. We also look for any differences in pulse strength between the arms and legs.
Right.
It's all about gathering information to get a complete picture of their cardiovascular health.
It's amazing how much information you can gather from these simple checks.
Yeah.
What about the abdomen? What's involved in that part of the exam?
The abdominal exam involves listening for bowel sounds and gently palpating the abdomen.
Oh, right.
We're feeling for any masses, tenderness, or organ enlargement.
Okay.
We also check for specific conditions like prune belly syndrome.
Prune belly syndrome?
Yeah, it's a rare disorder characterized by a lack of abdominal muscles.
That's a condition I've never even heard of before.
It's very rare.
Are there any other abdominal abnormalities you look for?
We also assess for flossulo and gastroschisis.
Okay.
Omphalocele is a birth defect where the intestines protrude outside the body through a hole in the belly button,
Oh, wow.
while gastroschisis involves the intestines protruding through a hole in the abdominal wall next to the belly button.
Okay, so two different but serious conditions.
Yes.
What about the umbilical cord itself? What do you assess there?
We examine the umbilical cord to ensure it has the correct number of blood vessels, 2 arteries and 1 vein.
Okay.
We also check the condition of Wharton's jelly, which is the gelatinous substance that surrounds the cord vessels and protects them.
Interesting. So even the umbilical cord can provide valuable information.
Absolutely.
So what's next on this head-to-toe examination journey?
Next up is a careful examination of the head and neck. We look for any bruising or molding from the birth process. Assess the fontanelles, those soft spots on the baby's skull, and check for any swelling.
Are there different types of swelling you look for?
Yes. The 2 most common are caput succedaneum and cephalohematoma.
Oh, those are some big words.
I know, right?
So break it down for me. What's the difference?
So caput succedaneum is swelling of the scalp that crosses suture lines on the skull,
Okay.
while cephalohematoma is bleeding under the periosteum, the membrane that covers the skull bones and doesn't cross suture lines.
Got it.
The location and pattern of the swelling can tell us a lot about what caused it.
It's fascinating how much you can learn just from observing. What about the baby's face? What do you look for there?
We examine the baby's facial features, or facies.
Faces.
Yeah, it's a fancy word for face.
I like it.
This is important because certain facial features can be indicative of specific syndromes or congenital anomalies.
So even the smallest details can be important clues.
Absolutely.
What else is included in the head and neck exam?
We make sure the eyes and ears are properly formed and in the correct position. We also assess the baby's breathing through each nostril to rule out any blockages.
Wow. It's incredible how much detail goes into this exam.
Mm.
Are there any other terms or conditions related to the head and neck that we should be aware of?
We look for things like microstomia, an abnormally small mouth opening,
Oh.
micrognathia, an underdeveloped jaw,
Got it.
and check for any signs of Pierre-Robin syndrome, a condition characterized by a small lower jaw, a cleft palate, and a tongue that can obstruct the airway.
Wow, so the head and neck exam is very comprehensive.
It is.
What comes after that?
We move on to the musculoskeletal system, spine, and extremities. We examine the baby's limbs for any deformities like extradigits or joint contractures. We also check for symmetry of the spine and look for any signs of spinal defects.
Can you remind us about some of those spinal defects?
We assess for things like spina bifida, myelin-meningocele, and encephalocele.
Wow.
These are all serious conditions that affect the central nervous system.
Okay, so those are things you definitely want to catch early on.
Exactly.
What about the baby's skin? What do you look for there?
We assess the skin color and capillary refill time, which tells us how quickly blood returns to the skin after we press on it.
Okay.
We also look for any unusual markings or rashes.
Are there any specific skin color variations that are important to note?
Yes, we differentiate between acrocyanosis.
Acrocyanosis.
Yeah, it's a bluish discoloration of the hands and feet that's common and usually harmless.
Okay.
And true cyanosis, which is a bluish discoloration of the skin, lips, and mucous membranes, which indicates a lack of oxygen in the blood.
Okay. So it's important to distinguish between those two.
Absolutely.
What about other skin patterns?
We also look for mottling, which is an irregular pattern of dusky and pale skin, and a ruddy appearance, which can be associated with a high red blood cell count.
So even subtle variations in skin color can provide valuable information.
Exactly.
Amazing. So after assessing the skin, What's next on the agenda?
We assess the baby's reflexes, those automatic responses to certain stimuli. Right.
Reflexes are a good indicator of the baby's neurological development.
What are some of the key reflexes you're checking?
We look for things like the grasp reflex, the Moro reflex, which is that classic startle response.
Oh, yeah, I've seen that one.
Yeah, and the stepping reflex.
So cute. Those are fascinating. Why is it important to assess these reflexes?
They provide information about the integrity of the baby's nervous system.
Okay.
The presence and strength of reflexes can help identify any potential neurological problems.
It's a glimpse into their neurological well-being.
Exactly.
Now, we've talked a lot about the general physical exam, but let's dig a bit deeper into the pulmonary examination.
Okay.
What are the key things you're looking for when assessing a newborn's lungs?
The pulmonary examination begins with a careful inspection of the chest wall. We're looking for any signs of respiratory distress,
Okay.
such as rapid breathing, breathlessness, head bobbing, grunting, nasal flaring retractions, low oxygen levels, and a bluish skin color.
Okay, we've already touched on some of those signs like grunting and retraction.
Yeah. But how can you tell if a baby is truly breathless?
That's a good question. Breathlessness can manifest as increased effort with breathing, visible use of accessory muscles, and a distressed or anxious expression.
Okay.
It's really a combination of visual cues and the overall effort the baby is putting into breathing.
So you're really looking at the whole picture.
Exactly.
Are there any signs outside the respiratory system that might hint at breathing problems?
Absolutely. Sometimes a baby might be anxious fussy or have a decreased level of consciousness.
Oh, wow.
These can all be subtle indicators of underlying breathing issues.
Okay.
It's a reminder that we need to consider the whole picture, not just individual systems in isolation.
Right, so one system can have a ripple effect on others.
Absolutely.
What other techniques are used to assess the lungs?
We carefully review the baby's vital signs, paying close attention to their heart rate, respiratory rate, temperature, blood pressure, and oxygen saturation levels. We also assess something called bronchial fremitus.
Bronchial fremitus.
Yes, it's a mouthful.
Break it down for me. What is that?
So it refers to vibrations felt on the chest wall when the baby cries.
Oh, interesting.
These vibrations can be increased if there's mucus or fluid in the airways.
Oh, so it's like a subtle tremor that you can feel with your hands.
Precisely. We also examine the baby's neck to make sure the trachea, which is the windpipe, is in the midline, and that there aren't any masses that might be compressing the airway.
Okay, so it's a very thorough assessment of the entire respiratory system.
Yes, it is.
What about listening to the lungs with a stethoscope? What are you listening for?
That's called auscultation, and it's a key part of the exam.
Okay.
We listen for clear and equal breath sounds on both sides of the chest.
Okay.
We also listen for any abnormal or adventitious breath sounds that might indicate a problem.
Can you give us some examples of those abnormal sounds?
Sure, there are crackles, wheezes, and rongi. Each sound has its own unique characteristics and can point to a specific issue.
Good.
For example, crackles might indicate fluid in the small airways, while wheezes suggest narrowing of the airways.
Wow, so you're like a detective listening for clues within those breath sounds.
Exactly.
Are there any other sounds you might hear during the pulmonary exam?
We also listen for stridor and sturdor.
Okay.
Stridor is a high-pitched noise that often indicates an obstruction in the upper airway,
Okay.
while sturdor is a low-pitched snoring sound that suggests an obstruction further down in the airway.
It's amazing how much information you can glean from simply listening.
It really is.
But we've focused a lot on the respiratory system.
Yeah.
What about the other body systems? How are those assessed?
Assessing a newborn goes beyond just the respiratory system.
Right.
We also assess their growth by measuring their weight, height, and head circumference.
Good.
This helps us determine if the baby is growing appropriately for their age.
Right.
We also look for any signs of developmental delay, neurological issues, muscle weakness, and consider how their cardiac function might be impacting their breathing.
Right. So one system can have a ripple effect on others.
Exactly. It's
Wow.
all interconnected.
What about the role of lab tests in all of this?
Laboratory assessments are often used to provide additional information that we can't get from the physical exam alone.
Oh,
They can help us confirm a diagnosis, figure out the severity of a condition, see how effective previous treatments have been, and monitor the baby's progress over time.
They're like a window into the baby's internal workings.
Exactly.
What are some of the common lab tests ordered for newborns?
Some of the most frequent ones are a complete blood count,
Okay.
which looks at different types of blood cells, a platelet count,
Right.
which assesses the blood's clotting ability, and measurements of hemoglobin and hematocrit,
Okay.
which indicate the amount of oxygen-carrying protein in the blood.
Can you explain those tests in a bit more detail? Like, what can they tell us about the baby's health?
Sure. So the white blood cell count, or WBC, is a part of the complete blood count that gives us information about the baby's immune system.
Okay.
A low WBC count could signal an infection or other issue with the immune system, while a high WBC count might also suggest an infection or potentially inflammation.
So the context is key when interpreting those results.
Right.
What about the platelet count? What's considered abnormal there?
A platelet count below 150,000 cells per cubic millimeter is generally considered abnormally low.
Right.
Platelets are essential for blood clotting, so a low count could increase the risk of bleeding.
That's important to know. What about hemoglobin and hematocrit? What do those measurements tell us?
Hemoglobin is the protein in red blood cells that carries oxygen throughout the body.
Okay.
And hematocrit is the percentage of red blood cells in the total blood volume.
Got it.
Newborns tend to have higher levels of both at birth compared to adults because they've been living in a lower oxygen environment in the womb.
Okay.
Those levels gradually decline after birth as the baby adapts to breathing air.
Fascinating. So it's not always a cause for concern if those levels are a bit higher in a newborn.
Exactly.
Are there any other lab tests commonly used in neonatal assessment?
There are many other tests that might be ordered depending on the baby's individual needs and medical history. These tests can be broadly categorized into non-invasive and invasive diagnostic studies.
Now that sounds intriguing. Can you tell us more about those different types of studies?
We can definitely delve into that fascinating area, but first let's take a moment to recap what we've covered so far.
Okay. Yeah, that's a good idea.
We've journeyed from the initial moments in the delivery room through a comprehensive head-to-toe physical exam and even explored some key lab tests.
Yeah, it's been quite a whirlwind of information,
It has been.
but it's also been incredibly insightful. I feel like I have a much better grasp now of what happens in those critical first few hours of a newborn's life. But I'm definitely eager to learn more about those non-invasive and invasive diagnostic studies you mentioned. What kind of insights can they provide?
We'll definitely unpack those in detail and touch on some other important aspects of neonatal assessment that we haven't had a chance to discuss yet.
I can't wait to dive back in. Stay tuned, listeners. We'll be back soon to continue our exploration of the fascinating world of neonatal care.
Absolutely. It's going to be good.
Welcome back to our deep dive into neonatal assessment. Before the break, you mentioned those non-invasive and invasive diagnostic studies.
Right.
What exactly are those, and how do they help you understand what's going on with a newborn?
Yeah, so these studies are like additional tools in our detective kit helping us delve deeper when needed.
So break it down for me. What's the difference between a non-invasive and an invasive procedure?
So it all comes down to whether we need to break the skin or enter the body. Non-invasive procedures don't, while invasive procedures do. Think of it like this. A non-invasive procedure is like peeking through a window, while an invasive procedure is like opening the door and stepping inside.
Okay, that analogy makes it much clearer. Can you give me some examples?
Sure. One of the most common non-invasive procedures is an ultrasound. I'm sure you've heard of it. It uses sound waves to create images of the baby's internal organs.
Yeah.
We use it to assess the heart, lungs, brain, and abdomen.
So it's a safe and painless way to see what's happening inside the baby's body.
Exactly.
What about invasive procedures? What are some examples of those?
One example is a blood gas analysis. This involves drawing a small sample of blood from an artery to measure the levels of oxygen, carbon dioxide, and pH.
Okay.
It helps us understand how well the baby is breathing and how their lungs are functioning.
That sounds like it provides crucial information, but it also sounds a bit riskier than an ultrasound.
You're right. Invasive procedures do carry a slightly higher risk of complications, but they can provide vital information that we simply can't obtain through non-invasive methods.
Okay.
It's always a careful balancing act, weighing the potential benefits against the risks for each individual baby.
It makes sense that you would choose the approach that's best suited for the situation. Now, we've talked a lot about assessing a newborn's physical health, but what about their neurological development? How is that evaluated?
Neurological assessment is another critical piece of the puzzle. We observe the baby's behavior, their movements, their responses to stimuli, and their reflexes to get a sense of their neurological well-being. Think of it like we're looking for clues about how their brain is developing and functioning.
What are some of the specific things you look for during a neurological assessment? What should parents be aware of?
We check their muscle tone, their posture, their alertness, and their ability to interact with their surroundings. We also assess their cranial nerves, which control things like eye movements, facial expressions, hearing, and swallowing.
That sounds like a very detailed assessment.
Mm-hmm.
Are there any specific tools or techniques used to evaluate a newborn's neurological development?
Yes. We use standardized neurological exams for newborns. One common assessment evaluates various aspects of neurological function, including posture, tone, reflexes, behavior, and cranial nerve function.
It's incredible how much attention is paid to every detail. Now, switching gears a bit, we've talked about physical health and neurological development, but what about their sensory abilities? How do you assess how a newborn is experiencing the world?
That's a great question. Assessing a newborn's sensory abilities can be challenging because they can't tell us what they're experiencing in the same way adults can. However, we can observe their responses to different stimuli to get a sense of how they're processing sensory information.
Can you give some examples of how you might assess a baby's sensory abilities?
Of course. We might shine a light in their eyes to see if their pupils constrict, which tells us their vision is working. We might make a loud noise to observe their startle reflex, which suggests their hearing is intact. And we might gently stroke their cheek to see if they turn their head towards the touch, demonstrating their sense of touch.
So it's all about observing their innate responses to understand how they're experiencing the world.
That's fascinating. Now, I want to touch on another important aspect of neonatal care: pain management. It's
Yeah.
something that I think a lot of parents are curious about. How is pain assessed and managed in these tiny little humans?
You're right, it's a crucial topic. For a long time, it was mistakenly believed that newborns didn't experience pain in the same way as adults do.
Really?
Yeah, we now know that's simply not true. Newborns are just as capable of feeling pain, and they might even be more sensitive to it than older children and adults.
That's heartbreaking to think about. So, how do you assess pain in babies who can't verbally tell you what they're feeling?
We rely on a combination of behavioral and physiological cues. Behavioral indicators might include crying facial expressions of distress, changes in body movements like arching their back or pulling their legs up, and difficulty sleeping or feeding.
It's like you're learning to read their body language.
Exactly.
What about those physiological cues you mentioned? Physiological indicators can include changes in heart rate, respiratory rate, blood pressure, and oxygen saturation levels. We might also observe pallor, which is paleness of the skin sweating, and dilated pupils.
So it's about piecing together those outward expressions and internal changes to understand what the baby might be experiencing. Once pain is identified, how do you manage it in such tiny and fragile patients?
Pain management in newborns is always tailored to their individual needs and the severity of their pain. For mild to moderate pain, we often start with non-pharmacological methods, things like swaddling, skin-to-skin contact, breastfeeding, and sucrose solution, which is essentially sugar water.
Okay.
These methods provide comfort and distraction, helping to reduce the baby's perception of pain.
Those sound like gentle and nurturing approaches. What about more severe pain? What are the options then?
For more severe pain, medication might be necessary. We might use acetaminophen or ibuprofen, which are commonly used pain relievers for infants. In some cases, opioids such as morphine or fentanyl might be prescribed for very severe pain, like after surgery. But we always aim to use the lowest effective dose for the shortest duration possible.
It's reassuring to know that there are effective ways to manage pain in newborns, even in challenging situations. Now, as we wrap up this part of our deep dive, I'm curious to hear your thoughts on the future of neonatal assessment. What advancements or innovations are on the horizon that might further improve the care we provide to these tiniest and most vulnerable patients?
That's a great question. The field of neonatal care is constantly evolving, and we're always striving to improve the care we provide. One area that holds immense promise is the development of non-invasive pain assessment tools.
Oh, wow.
Imagine being able to accurately measure a baby's pain levels without relying solely on those behavioral and physiological cues, which can sometimes be subjective.
That would be a game changer. It would remove a lot of the guesswork and ensure that babies are getting the right pain relief. Are there any other advancements on the horizon?
Absolutely. Researchers are also exploring the use of artificial intelligence, or AI, in neonatal care.
Oh, wow.
Imagine AI-powered systems that can analyze data from various sources like vital signs, lab results, and even video recordings of the baby to detect subtle signs of illness or distress that might be missed by the human eye.
That sounds so futuristic, but also incredibly promising.
Yeah.
Early detection of problems could lead to faster interventions and better outcomes for these fragile babies.
Exactly. The possibilities are truly exciting.
It's clear that the future of neonatal care is filled with hope and innovation. But for now, let's shift gears and talk about an equally important aspect: the role of the family in neonatal care. I think this is something that many parents, especially first-time parents, might be wondering about.
You're absolutely right. The family plays a vital role in a newborn's care. Their love, support, and involvement are essential for the baby's well-being and development. It's truly a team effort.
So let's talk about that team. What are some specific ways that families can be involved in their baby's care, especially in those early days and weeks? What can parents do to actively participate in their baby's journey?
One of the most powerful things families can do is provide skin-to-skin contact, also known as kangaroo care.
I've heard of that.
Yeah, it involves holding the baby against their bare chest.
Oh, that's so sweet.
This simple act helps regulate the baby's temperature, heart rate, and breathing. It's also incredibly beneficial for bonding and reduces stress for both the baby and the parent.
It sounds like such a beautiful and natural way to connect with a newborn. Are there other ways families can be involved in their baby's care?
They can also play a key role in feeding, whether it's breastfeeding, bottle feeding, or a combination of both. Learning how to properly position and support the baby during feeding can make a big difference in their comfort and ability to eat effectively.
It's all about empowering families to participate in their baby's care. What about those situations where a baby needs more intensive care, perhaps in a neonatal intensive care unit or NICU? How can families stay involved in those settings, which can often feel overwhelming and intimidating?
That's a challenging situation for any family to navigate. But even in the NICU, there are many ways for families to stay connected and involved. They can visit their baby as often as possible, talk to them, sing to them, and touch them gently. These interactions can have a profound impact on the baby's emotional and developmental well-being.
It's heartwarming to know that even in the most technologically advanced settings, the power of human touch and connection remains so important. Now, before we wrap up this deep dive, I want to revisit something we talked about earlier: the long-term health and development of newborns. We focus a lot on those initial assessments and immediate care, but what are some of the key factors that influence how babies grow and thrive in the months and years after they're born?
That's a great question, and it's a complex one. There are so many factors that contribute to a baby's long-term health and development. Of course, genetics plays a role, as does the environment in which the baby is raised. Nutrition is incredibly important for healthy growth and development, and breastfeeding, whenever possible, provides numerous benefits including immune protection and optimal brain development.
So it's a combination of nature and nurture. What about social interactions? How do those shape a baby's development?
Social interactions are absolutely essential for a baby's cognitive, emotional, and social development. Responding to a baby's cues, talking to them, singing to them, reading to them, and playing with them all contribute to their developing brain and help them learn about the world around them.
It's a beautiful reminder that even the simplest interactions can have a profound and lasting impact. Now, as we conclude our journey through the world of neonatal assessment, I'm struck by the incredible progress that's been made in this field. We've gone from a time when babies born prematurely or with health complications faced much bleaker prospects, to an era where even the tiniest and most fragile infants have a fighting chance at a healthy and fulfilling life.
You've captured it perfectly. It's truly remarkable how far we've come. Advances in medical technology, coupled with a growing understanding of infant development and the importance of family-centered care, have transformed the landscape of neonatal care. And the best part is that the journey of discovery continues with ongoing research and innovation paving the way for even better outcomes in the future.
It's been an honor to delve into this fascinating topic with you and our listeners. We've covered a lot of ground, from the initial assessments in the delivery room to
Yeah.
the ongoing care that these precious little ones need to thrive. But as we've emphasized throughout this deep dive, learning is a lifelong pursuit.
I couldn't agree more.
So to our listeners, we encourage you to continue seeking knowledge, asking questions, and advocating for the well-being of all newborns. They are the future, and they deserve the best possible start in life.
Well said.
And on that note, we'll wrap up our deep dive into neonatal assessment. Thank you for joining us on this incredible journey of discovery. We'll be back soon with another fascinating topic to explore. Till then, keep learning and keep exploring. Welcome back to our deep dive, everyone. We've been talking all about the incredible world of neonatal care.
Yeah, it's pretty amazing, right?
It really is. We've gone from those very first moments in the delivery room
Right.
to really getting into the nitty-gritty of how to assess a newborn's health and development.
Absolutely. It's been quite a journey.
It has. And before we wrap things up, I really want to circle back to something you said earlier about the role of the family.
Okay.
It's just so important for parents and caregivers to feel empowered and involved in their baby's journey.
You're so right. The family is a crucial part of the care team. Their love and support and involvement can make a world of difference.
Absolutely. So let's talk about some practical ways that families can get involved in their baby's care, especially in those first few days and weeks.
Okay. One of the best and most impactful things is skin-to-skin contact, also called kangaroo care.
Yeah, I've heard of that.
It's as simple as it sounds, just holding the baby against your bare chest.
It's so sweet.
It really is. It helps regulate the baby's temperature, heart rate, and breathing. And it also creates this incredible bond between the parent and baby.
I love that.
Yeah.
Are there other ways families can participate?
Absolutely. They can also play a big part in feeding, whether it's breastfeeding, bottle feeding, or a combo with both.
Right.
And learning how to position the baby during feeding can make a big difference in their comfort.
It's all about giving parents the tools to feel confident.
Exactly.
But what about those situations where a baby needs a higher level of care, like in ICU?
Yeah, the NICU.
How can families stay involved when it all feels so overwhelming?
It's true that NICU can be intimidating. But even in that environment, families can still be very involved.
Well, good.
They can visit as often as possible, talk to their baby, sing to them, gently touch them. Even the littlest things make a difference.
It really shows you the power of human touch.
It really does.
As we wrap up our deep dive today, I want to leave our listeners with something to think about.
Okay.
We've talked about the first few hours and days, but of course, development doesn't stop there.
Right.
So what are your words of wisdom for new parents as they start this incredible journey?
Every baby is unique.
That's so true.
They develop at their own pace, have their own needs, their own personalities. As parents, we get to be a part of that incredible journey.
And it is an incredible journey.
It really is. It's about embracing the ups and downs and creating that loving environment where they can thrive.
It's been awesome exploring this topic with you.
Likewise.
We've really gotten to see the heart of neonatal care, and I hope our listeners feel the same sense of awe that I do. To everyone listening, thank you so much for joining us on this deep dive into the world of neonatal assessment. Keep asking questions, keep learning, and keep advocating for these incredible little humans.
They're the future.
They are. And on that note,
Yep.
this is the end of our show. Until next time, keep those curious minds engaged.